Okay, so this first video I'm making here is in regards to number 12 here, the question that's asking which manual techniques would be appropriate for this patient. In this case, I got patient A with radial wrist pain, and what's your rationale for each? Well, with the presentation of pain that the patient's demonstrating, its point tenderness, the pain qualities aren't burning or tingling or numbness, so I'm not really suspected of nerve involvement. So I'm gonna probably leave upper limb nerve tensioning or nerve mobilizations out of the picture for right now, and probably focus on other soft tissue structures that could be involved. So for one thing, I'd do soft tissue mobilization, doing cross friction, a cross friction method to address the potential tendonitis that's going on there. Based on the results we get from our examination, there's a likely scenario that this patient has D. curvaeans tenosynovitis, which could be the first compartment extensors, the abductor pollicis longus and extensor pollicis brevis tendons that could be inflamed. So that could be a technique I could use to maybe address that. But also mobilizations, PA mobs, radial, ulnar glides and PA glides of the carpals. Those are indicated. That case study that was posted on Canvas was basically about a very similar patient there, and those mobilizations tend to be effective, at least for that patient. So it's something I'd want to consider there. And also just taping techniques. Also, another thing I could be doing for the tendon is basically just taping the tendons, repositioning them in a direction that will relieve pain for the patient. Their patient basically demonstrates pain with ulnar deviation, so I could maybe take those first compartment extensors, try to roll them essentially either ulnarly or radially, have the patient ulnarly deviate, and if there's any reduction in symptoms, I'd want to consider doing that. It could be the repositioning of the tendons, it could be the compression that the tape is causing to inhibit pain receptors of that wrist. And either way, if it's effective, I'm definitely going to give it a try. But the other thing I need to think about too is, what if it's not tendons? There's other structures that could be contributing to that point tenderness on the radial aspect. I'm thinking, ligamentous. You got the radial carpal ligaments that could be constantly stressed from that repetitive hammering motion, which I would, believe to be the underlying mechanism for the patient's impairments. So it's a chronic traumatic stress on tissues in that area. So I don't want to leave that out of the realm of possibility, and even the joint capsule on that radial side, also prone to that tensioning stress from constant hammering. So, essentially there needs to be a way to address that, to really make an effect, on reduction of symptoms. So those are the manual techniques that I would start with right now, and maybe moving forward, if it doesn't work, I got to figure something else out.